Western Cape Premier Alan Winde says that as citizens we need to have a change of culture in order to prevent violence. Launching the area-based teams in Delft today as part of the Violence Prevention Unit. The Premier addressed various members, community members of Delft, as well as members of his cabinet, including the MEC for Health and Wellness, Dr. Noma French Mbombo, and also the Community Safety and Police Oversight MEC, Regan Allen. Premier, very warm good day to you. We've seen today the introduction of these 20-odd members of the area-based team. Let's talk about the Violence Prevention Unit, and you were also talking about it being a work in progress. Explain to us the concept and why it's seated in the Department of Health and Wellness.
So first of all, I think everyone knows that I want a changing in the policing model. I want more power to make decisions around policing in the province, and I would like that to change. And we've got a safety plan where we've put, between the city and ourselves, extra officers on the ground, and you can see the difference when you use data and evidence and policing. But of course, you can't police your way out of crime totally. You've got to address the root causes of crime, and that's what the Violence Prevention Unit is for. It's lessons that we've learned from colleagues in other countries who've shown what they've done over time. The Cardiff model, which we call it, out of Cardiff and Glasgow as well, they do it. But we've looked at Colombia, specifically because of drugs and drug lords, etc., and gangsterism. But we've taken sort of from various parts of the world and said, how do we start to look at violence prevention? And that's addressing the first 1,000 days of a child's life, because if you can get the right care, nutrition, medical process happening in that time, you start to set up that child for a better future. It's the after-school programs that keep you out of the gangs, or it's the various programs from different departments. The economy is just as critical. How do businesses get going? How do you create jobs? What are the opportunities like? And so what happens is, over time, you start to change the culture, and you start to embed different values in society, and we help each other. And so that's the start now. We've been doing this for a few months now. The Violence Prevention Unit's in place. We've got to measure violence differently, and we then deploy social workers. We then deploy different NGOs. Communities come up with issues that are affecting them. And so over time, and we've seen this from around the world, that you'll start to develop a culture, and that's how we really will start to build the future of a safety of a region, at the same time obviously not stopping the policing.
You talked about data and evidence-based in order to allocate resources. Let us just understand what this means. For example, data collected from an EC, an emergency centre. How will this then have an impact on how many police or law enforcement are deployed? Explain that concept to me, please, Premier.
So our health team started this prior to the pandemic, measuring trauma in our main hospitals. We found in the pandemic that became a live data source. That system could tell us how many beds were in use, who was using those beds, what the turnaround was. And so we said, well, how do we get this out to every one of our health facilities? And then can we not only just use this trauma data for health reasons, but for safety reasons? So now when a stab victim ends up in our hospital, we know where the ambulance collected that person, what time of day or night it was, what the cause was of that stabbing, and we've got to track through to our trauma center. And then that enables us to deploy the police officers or the law enforcement officers, our LEAP officers, to that hotspot, because we see there's a number of them on that street corner. But the data also then helps us to give us causalities. It was alcohol related, or it was drug related, or it was gang related. And then that data helps us again to say, well, how do we start with violence prevention programs to fix that problem? It could be parenting programs, which we're now running through our Yebone and Social Development Department. So it's about learning as we're going, using a framework of an international model, but building our own systems within it. And this is a key mechanism of measuring the data, because then we can see, are we getting better or not?
You are launching these area-based teams here in Delft, firstly, and then also in the midst of the 16 Days of Activism of No Violence Against Women and Children. What is the significance of that, with Delft being one of the areas with quite high crime rates?
Yeah, we've always known Delft has been a hotspot. Delft has been a deployment area of LEAP officers, but the stats came out 2 weeks ago, and you could see immediately something else is happening here in Delft. So don't sit back. action. Get in there, and that's what this is about. And that's what the safety plan is about. Crime patterns change. You must be able to respond quickly. You can't do it next year. You must respond immediately. Now, we know gender-based violence issues are a big issue here. We've got great partners here, especially where we are now at the Next Centre, which is a Bavarian government partnership, which we've had for a very long time, and of course the Hope Foundation, who raise a lot of money to help citizens, and this centre is a place of hope, and of course a great place to launch this program, where community, NGOs, neighbourhood watchers all come together in the interest of building safety in this community.
Premier, thank you very much for your time. Of course, Premier Alan Winde, a Western Cape Premier, talking to us about the launch of the area-based teams here, which form part of the Violence Prevention Unit and their work to bring down violence. Of course, earlier Premier also telling us, reiterating again that the province has a vision of decreasing the murder rate by 50% in the Western Cape over the next 10 years, and saying that the programs, for example, like the Violence Prevention Unit, will need to adapt constantly in order for the province to reach this goal.